My name's Drew Nash. I'm a primary care pediatrician in Danville.
What should a new parent look for in a pediatrician?
Well, I think what you have to realize first is that physicians and pediatricians are people, and like any other person or any other relationship, you're going to have different personality types, and not every personality is necessarily going to be the right person for you as an individual parent. So it's nice to be able to meet the person first and talk to them. Ideally, we're talking about a long-term relationship. They'll be helping you to raise your child from birth through adolescence and even through college. So it needs to be someone who you feel like you're going to be able to get along with, and someone who you're going to be able to trust when they give you their opinion about something. So the personality has to match.
Mm-hmm. So do you recommend interviewing quite a few pediatricians? Or?
You don't have to necessarily interview a whole bunch. A few would be nice. Ideally, you're going to draw from your community resources and find out from some neighbors or some friends the name of a few people who have been recommended to you and kind of go from there. I don't think you need to go through the telephone book and look at everybody who's listed, but to get a sense of 2 or 3 different people in maybe a couple different practices, because you're going to find differences. You're going to find differences in personality. You're going to find differences in their approach to taking care of your child, and differences in just the nuts and bolts of availability and things like that too.
As a pediatrician, when you get a call from a parent, what information do you want them to give you before they come in and visit you if your child is ill?
So in a situation where you're dealing with a child who's ill, the first question that is going to come up is whether or not the child has a fever or not, and the degree of fever. In the first few months when a baby's really young, it becomes an issue of how accurate the measurement is, and we usually want to know what the rectal temperature is. And it matters. 101 versus 100.1 will make a difference medically. For an older child, I usually care more about whether there's a fever and whether if there is a fever, it's low or high, 104 versus 101, and how the child looks, what they're doing. So those are the first kind of questions. I think if you have sort of an idea of what symptoms you're worried about, and tell the doctor what your concerns are. Sometimes when people call, they just are reporting a cluster of symptoms and aren't really able to let me know whether they're just looking for reassurance. The child has a stuffy nose and a cough for a couple of days, and is this a cold? Yes, it sounds like one. Or whether they are worried about something else going on. Like, for example, we're having a lot of questions like that with the whooping cough epidemic. So to know what your concerns are as a parent will help us kind of answer those questions.
I had a pediatrician tell me recently that he felt his job was more like helping in child rearing these days than actually practicing medicine.
Depends on the situation. Certainly I get a lot of behavioral questions. A lot of what we do in pediatrics is answering questions about child development. Is this normal? Is this not normal? Probably once a week someone will tell me something that their child is doing that I've never heard before. Not that that's not normal, and I usually reassure them, but a lot of what we do is developmental work, describing to parents whether or not we think that behavior is a normal one, and if not, what we should do about it. A lot of the behavioral things don't necessarily require an office visit. Someone has a behavior that is stereotypically associated with an abnormality, like spinning around in a circle, is that they're doing that a lot. If otherwise the child is normal, then I don't have a concern about that. If their global development is more abnormal, then you might be more concerned. So you have to know the child and put those all those bits of information into perspective to get the big picture.
Now, how long have you been a practicing pediatrician?
I've been a practicing pediatrician for 17 years.
How have you seen the field change of pediatrics?
Oh, it's changed a lot. Mostly managed care. There's a lot of more pressure from insurance companies to see patients more quickly and to see patients faster.
What changes have you seen in child rearing?
Just the amount of technology interference. I mean, when I was a kid, if my friend Jason called me, it rang in the kitchen and my dad answered it, and they'd say, "Nah, he's doing homework. He'll call you back in an hour."
Right.
That was how that worked. Or everyone knew who was talking to who because they had to go through our parents to get to us.
Right.
And that's just not true now.
What do you enjoy most about being a pediatrician in this area?
I really know my patients much better when I've seen them right from the nursery. And that's been the first visit. right after they're born, as opposed to assuming care of them when they're older. It's nice to remember those early times.